Hello everyone. So today is yet another practical class, and these are the spotters class which we are taking. So under spotter class, we have finished many things, including some system also, and here is the drug dosage form. If I remember, I have already taken this class when we started practical or on the initial days of our classes, I guess. Still, if I haven't, then also I'll be taking it, and it would be there as some of the spotters. In the examination, you would be having around 8 to 10 of spotters, in which there would be many things kept, among which these doses form would be either 1 or 2 or 3. Apart from this dosage form, we would be having the crude drugs like the plant extract or the animal plant parts or parts of the animal parts, or extract also we can put it. And then the drugs, the medicines related questions would be there. Whatever spotter we keep, and then clinical cases also will be keeping as a spotter. Whatever spotter will be keeping, it will be associated with 2 or 3 questions, and 2 and 3 questions are will be smaller, like the answer for which you can write in a word or in a sentence or 2 sentences. Sometimes mechanism of action is also asked as a part of the spotter questions. There you should ensure that you are writing in short, but all the important material, all the important elements should be there in the answer. Okay, so mechanism of action can be a very big thing to explain, right? And you don't have that much of time in the examination to write. You'll be hardly allotted 1 minute per spotter. 1 minute per spotter, in that 15 seconds goes in analyzing and seeing the drug or the spot only. Then after that 45 minutes you get to think and write. So those thinking and writing should be simultaneous. You cannot spare the separate time for thinking and separate time for writing. Then you will be missing few questions. So see the spot, analyze the spot in just 15 seconds, and then start writing, start thinking and start writing simultaneously. Then only it will be over. And then when you are given extra time just to check what have you written for any correction or so, then also you can just complete the answers which could not be completed. So here drug dosage form, there are many dosage form of a single drug, right? We usually in pharmacology deal with generic name of the drug, not the brand name. So any generic drug will be having many dosage form. Dosage form is in which it appears, in which it is sold, in which it is taken by the patient. So those are the dosage form. And if you define the dosage form, then can be called as the product designed for suitable administration of a drug to a patient for diagnosis, prevention and treatment of a disease or relief of symptom. So they are the medicinal product containing 2 or more than 2 ingredients, which is meant to administer inside the body for the purpose of diagnosis, prevention, treatment of a disease or a relief of a symptom. Now there can be many dosage form, and we all know that there are like ointment, there are kid cream, there are tablets, there are powders. There are injectables. Injectables are also of many times. There are eye drop, there are sprays, there are syrups, there are emulsions, there are suspensions. So many dosage forms are there. Say for example, on one drug is there like pentaprozole. You will find many formulation for that. You will find the injectable also. You will find the tablet also, the capsule also. So many dosage form are there. Why do we need so many dosage form of a single drug? That is the question. Why do we need many dosage form of a single drug? And the answer can be of many fold. See, another like these are the liquid preparation also. We have here the syrup. Here we have the another type of tablet, that is film coated tablet. There is hard gelatin tablet. There is suspension and there is injection. Now, what do we need various dosage form? First is for the protection of a drug from destructive influence of atmospheric oxygen or moisture. Now, as we know that there are many landforms in our country, or in the whole world, there are many landforms. We have the hill stations, we have the places at high altitude, we have at the lower altitude, we have the plains, we have the plateau, many type of landforms are there. And the atmosphere, the climate or the weather is different from one place to another place. Just to and one particular dose form will not be stable in all the dosage form. May not be stable. They are made stable. Okay, so like if there is possibility of getting the drug destroyed in a hard atmosphere, like the soft capsules or the creams in the desert areas, or where the temperature remains very high, either we have to make it the atmospheric stability we have to give, or if not possible, then that dosage form will not be used. Another like injectable, which will not have any effect, that will be used. Then we have for the protection of drug from destruction by gastric juice on oral administration. This is the very important reason for having more dosage form. See, gastric juice is very strong secretion in our body, and it can destroy many things. If we want some drug to act on the intestine or get absorbed from the intestine, then there is every possibility that the drug would be destroyed in the gastric juice in the stomach itself. It will not be able to reach to the intestine. So we make some coating to the tablet so that it will only the coating will prevent the drug or the dosage form from the gastric juice, and then it will be passed on to the intestine, and from there it will be absorbed there. Gastric juices, this is one of the very big reason for insulin not to come as the oral preparation or the penicillins, because it gets destroyed in the gastric juice. To mask the bitter taste or foul odor of the drug. Many times if we give a drug in a powder form, and if we ask the patient to take it, the patient will feel very bad taste of the powder if it is really very bitter. So to mask that, we first make it to the tablet form and then coat it with the syrup, and we coat it with the syrup. Please excuse me. हेलो हेलो हाँ क्लास ले रहा हूँ जरूरी नहीं है क्लास. So here to mask that bitter taste, that drug is made into capsule or syrup or any other to provide extended drug action through controlled release mechanism, which means If the drug, if we give in a simple tablet form or the capsule form or the powder form or the any other form, it may have the limited duration of action, say for 2 hours. But if we want the duration of action to be increased to 4 hours or 6 hours, then something else we need to do. And that is where the retard and spatule, they are the advanced form of the tablet or the capsules. They are made in such a way that the action would be given for prolonged period. So that is another dose form. To provide optimal drug action on the topical application. So that is also one of the reason. To provide drug from insertion into the body like rectum, vagina and ureter. Now these are the very trickier place. If you want any medicine to give at this place, and if you don't have the proper dosage form, then you will opt for the systemic dosage form like tablet, capsule or the injectable which may have the systemic side effect also. So if we want the local action to be inserted in this, that means we have to make one separate dosage form, and for that suppository and pessaries comes into play. Suppositories are meant to put in rectum, whereas the pessaries are meant to put in vagina, whereas urethra is bogies. To prevent a liquid preparation of substance which is insoluble and unstable, like many times you get a drug which is not soluble in water or which is not soluble in vehicle. Vehicle means in which is the liquid form. Like glycerin is the liquid form, or any other solvent is the liquid form in which you need to dissolve the solid. And if it is not dissolvable, then it is very difficult to give to the patient. In that case, you make it miscible by adding some other thing which is known as suspending agent or emulsifying agent. Emulsifying agent is added when there are liquid preparation that like oil and water, and suspending agent are those in which solid and solvent are the phases. To provide for placement of drug within the body tissue, injections, then to provide for liquid dosage form of soluble substance in desired vehicle, it is solution. Then to provide action of inhalational route. Now this is also one trickier part, through nose or through mouth. If you have any inhalational drug you want to give, then simply you cannot give to have the local action and more action. So you need to make it to another form like aerosol. They are the better dosage form to be given through inhalational route. So these were the these were the main important reason for having many dosage form. Drug dosage form for external use, like we have powders, ointment, creams, lotion, liniment, plasters, pessaries, bogies, suppositories. Drug dosage form are mainly of 3-4 types, you can say: solid, the liquid, the gas, and then the semi-solid. 4 types of dosage forms are there. In solid, we have tablets, we have capsules, we have powders, we have granules. Liquid, we have mixers, solutions, suspensions, syrup, elixirs. So solid dosage form like tablet, capsule, powder, granule, suppository. Solid dosage form, whatever dosage form, if it is a solid in nature, it will become a solid dosage form. See the tablet, we have many kind of tablet, like for say, these are the tablet. We have this one. This is a tablet, and again this is also a tablet, right? So the only the thing is inside this also is the tablet. Inside this is also a tablet. Only the difference is that the packing of this or the ingredient inside it. So packing of this is the normal packing, where there we have the plastic transparent thing up, and then the aluminum foil in the down. Here we have the aluminum foil up also, which is not transparent, and down also. And this type of packing is known as alu packing. Alu packing. ALU packing. Now the thing is, this is kept in this packing maybe because the drug which is inside this may be not very stable drug. Okay, it needs to be protected from sunlight or moisture or the environmental condition. So it is being put as alu packing. or to look also, sometimes looks also is a matter for this type of packing. So here is the drug levocetirizine, phenylephrine, and ambroxol tablet, whereas here is dispersible paracetamol, paracetamol tablet. So these are tablet. Now not different inside this may be some other different type of tablet would be there. Like if I break it open and we'll see this is a very small tablet. Okay, this is a very small tablet and normal tablet similar to this type. Okay, so this is there. Many a times you'll have the okay. What is tablet? Tablet is a dosage form in which solid drug powder is compressed. It is compressed. Okay, if you see the tablet, see this is disc-like structure. This is disc-like structure, and this is compressed. Compressed in a discoid shape. It's compressed in a discoid shape. So powder material comes from up, and there are two punch machines from up and down, one from up, one from down, and then powder comes from here, and this punching machine will punch the powder to make it in a tablet form. Now this tablet contains many ingredients. Apart from the active ingredient, the drug, there are diluents. Okay, there are adjuvants. There are binding agents which will bind the ingredients here inside. So there are many things. So you can explain. You can say that the tablet is a dosage for solid dosage form made up of two or more than two ingredients which are compressed under high compression and given a discoid shape. Okay. Uh, Now, come see, these are the diluent, binder, disintegrant, lubricant, coloring agent, sweetening, and flavoring agent. They are being put inside the tablet. There are various shapes and various sizes of tablet. We have the matrix tablet. We have the matrix tablet where there is drug and there is a matrix inside here, which is first released to give the instant action, and then slowly other part of the medicine is released to give the prolonged action. There we have the uncoated tablet and the coated tablet. Uncoated tablet like chewable tablet, like Diagene tablet comes with a chewable tablet. Vitamin C comes as chewable tablet. Effervescent tablet or lozenges are there for cough lozenges, soluble, and then sublingual tablets are there, nitroglycerin sublingual tablet, which is meant to be put in a buccal cavity. Coated tablets like entry coated tablets, film coated tablets, implants, sugar coated modified release tablet. Chewable tablets, these are usually colored and vitamins and antacid. Effervescent tablet, when you put inside the water, the carbon dioxide is released, along with that medicine is also released, and then it makes a solution and then you drink it. Lozenges and troches, this is the cough lozenges, which are more like chocolates only. So the medicinal chocolates are there with the sweetening and binding agents. Soluble tablet, you take the tablet, put in the water, there will not be any carbon dioxide released, but you can dissolve it and then drink it. Sublingual tablet, you need to put in buccal cavity. So nitroglycerin, it provides the fastest action, very fast action actually, very fast action. Under the tongue, if you put it, the blood circulation under the tongue is the faster and very less area and needs to be penetrated. So the drugs goes directly into the systemic circulation and gives the effect. That is sublingual tablet, or hyoscine also comes in sublingual tablets. Then the entry coated tablet. Entry coated tablet, which means the one coating is you must have seen the brufen or some other drug which is colored and some coating is there on the tablet. So those are entry coated tablet. These are meant. This coating is meant the drug to resist the gastric acid and go to the in the small intestine from where it will be released. So this coating is being done. Cellulose acetate phthalate. Cellulose acetate phthalate coating is put on the tablet to give a new dosage form, which is called as entry coated tablet. Sugar coating, if the drug is not very of good taste, and there you give a sugar coating. So when patient takes, it will feel the sweet taste of the drug, not the bitter taste. Implant, these are the tablet. Actually, these implants are like stick-like structure. The tablet is inserted under the skin through a small surgical cut. So they are stick-like structure. Mainly, the oral contraceptive pills are put in this way, and a small cut is being made on the skin, and the stick are placed inside the skin, and from there it is slowly released. So this type of dosage form is really very effective in case of in case of contraceptives. The duration of action may go up to 5 or 6 years also. Film coated tablet. The tablet is covered with a thin layer of or film of polymeric substance. It protects the drug from atmospheric condition, masks the objectionable taste and odor of the drug. Now, film coated tablet, there is a coating of polymeric substances. It will give a shiny appearance, and it just prevent the drug from the atmospheric condition, and it will mask the taste of the drug. That's it. Mask means it will not give any other taste like sweet or sour. It will not have any taste. It will just mask the actual taste of it. Modified release tablet. This type of tablets are meant to give the longer duration of action. Then comes capsules. Capsules, you must have seen these type of capsule, right? This type of capsule. They are the typical capsule, gelatin capsule, made up of gelatin, hard gelatin capsule. So they are the solid dosage form. You need, whenever you define dosage form, you have to put whether solid, liquid, gas, or semi-solid. These 4 things you have to decide, and then you have to go forward. They are the solid dosage form in which drug in the powder form or granules. Many times you will see that transparent capsules are there, in that granules are there. Okay. So it can be powder, it can be granule. It's put in the capsule which is made up of gelatin. Okay. So there are types like hard gelatin capsule, soft gelatin capsule, and modified release capsule. A hard gelatin capsule, we have body and we have a cap. So here red and yellow color is there. So one may be the body, this may be the body, and this may be the cap. And there is a lock present in the cap. So when you put when you join together body and cap, click sound comes, and then those are locked. So it is easy for transportation and all. And then they are packed into. When you take it, the gelatin first dissolves, and then drugs are eliminated. Drugs are liberated. Hard gelatin capsule and this soft gelatin capsule, that they are shining and looks so pretty. So the vitamin capsule or the pudin hara capsule comes in this soft gelatin capsule. Not needed. Spansules. Spansules are like these are the capsule only in which we have the granules of different sizes. Okay. So the smaller size granules, they will be released fast, they will be disintegrated, they will be dissolved fast, and then will give the action, initial action, and then the prolonged action will be given by the larger granules. The pellets, these are the small rod-shaped or ovoid sterile dosage form composed essentially of pure hormone in compressed form. Then we have pills. Pills are small, ovoid, solid bodies made from mass of drugs with aid of some adhesive or sticky material called excipients. Now the only contraceptive pills are reserved or comes under this type of dosage form. Then we have powder. Powder generally are not taken as powder itself because it will have the choking hazard. So the powder are generally dissolved in water or some other solvent, and then they are taken. One classical example is the oral rehydration salt, which is there in the powder form, and then you put into water and then drink. The powder is a solid dose form. Solid dosage form which contains one or more ingredient in dry and finally divided state. So they are the powder which are not compressed. Okay. What are the advantages of this? flexibility in compounding, good chemical stability, specific doses can be calculated, smaller particle size dissolves more rapidly for instant action, large quantities can be dispensed, more easy to carry than liquid, economical, and ease in children and old persons. What are the disadvantages? Not suitable for unpleasant drug. So just assume that some powder, a big amount of one spoonful, tablespoonful you are taking. Then if the taste is not pleasant, the taste is bitter, you will be dying with the taste of the drug. Deliquescent and hygroscopic drug cannot be dispensed like menthol, camphor, and thymol. So it's entirely impossible to dispense this type of drug in powder form. Volatile drugs are not suitable. Uses as lubricant, absorbent, antiseptic, and antipyretics. Not needed. See example for another example for dosage form, and then this one is regular, okay, bulk powder. Powder for injection. Many times you must have seen that there is the antibiotic glyphosate group, I guess. That comes under in powder form in the vial. You need to mix the water for injection, dissolve it, and then give it. So that is powder for injection. Powder for inhalation, many times rotaheller you will see as powder of inhalation. I'll show you the rotaheller. Yeah, we have rotaheller here. See, this is the rotaheller, and here this is loopyhaler, specific name. Here two parts are there, body and the cap. You remove the cap and then see, this is the whole structure. Okay, you have 2 points here. These are the buttons. Okay, and this is the mouthpiece which it has to be put in the mouth. How it has to be? You have to open it. You have to open it, twist it open, and then a specific capsule comes for taking it and for using this. So you have a groove inside this. You have a groove inside it for placing the capsule. You put the capsule inside it and then lock it, and then lock it. Okay, and then you press. You need to press this button. Okay, 2 buttons. So when you press, if you can see, if you press the button, 2 pin-like structure comes out. 2 pin-like structure comes out. Okay, this pin-like structure will puncture the capsule, and then drug will come out. And when you inhale like this, so a rotating sound comes of the capsule, and then drug goes inside. This is known as rotaheller. Then comes suppository. As I told initially, only suppository are meant to be the putting the rectum. Solid medication are mixed inside this, and these are usually bullet shaped so that it can be inserted easily. They get dissolved there, and then actions of the drug is given. Cocoa butter, glycerinated gelatin, and polyethylene glycol or sodium stearate are the compounds which are mixed with the drug, so that it can be inserted easily. They should be non-toxic or non-irritant to the mucous membrane. Otherwise, the problem will be, the patient will be in deep trouble. Can be used for systemic or local purpose, especially very good for the children who cannot take the drug easily through mouth or injection. Then solid medicated preparation designed for injection into the vagina. So here these are known as pessaries. Semi-solid dosage form like ointment, like the cream or the paste. So you must have seen the ointment and the cream, and you must have used also, right? So this is one paste, Kenacort. This is Kenacort. This is the triamcinolone, and this is a paste. This is a classical example of paste. So paste. Then we have ointment also. So the calcipotriol ointment is there. calcipotriol ointment is there. So these are the semi-solid dosage form. Okay. These are the semi-solid dosage form. So ointment is a semi-solid preparation, or cream is a semi-solid preparation, or paste is a semi-solid preparation for external application, further emollient, soothing, and sometimes systemic action containing active ingredient in a suitable base and is to be applied with or without rubbing. Types of ointment, there can be epidermic, endodermic, and diadermic, not of use. Then paste. Paste contains high proportion of finely powdered solid like zinc oxide and starch. That is very important thing, which makes it different than ointment and cream, where we have not high proportion of finely powdered solid. Less occlusive than ointment and used to protect subacute or excoriated skin. Cream. Cream are semi-solid preparations for external application without rubbing. They contain active ingredient in water-soluble base and sometimes oily-soluble base. So if it is water-soluble, then it would be O by W, or oil-soluble, then it would be W by O. Miscible with skin reaction. So there are two types: oil in water and water in oil. So oil in water example is vanishing cream, whereas water in oil is good. Now liquid dosage form: solution, suspension, emulsion. They are the liquid dosage form. So what do we see here? Mixture. Mixture is a liquid medicament meant for internal use, containing one or more ingredients either in dissolved, suspended, and emulsified state. Bottles are used when more than one dose of drug is to be dispensed. Hostas or draught are used when only one dose is to be dispensed, with the exception of emetics draught, in which several doses are prescribed in multiple dose container. So mixture are the liquid dosage form which are meant for the multiple use, whereas draught is a single use mixture. There can be many types of mixture like solution, suspension, and emulsion. Solution is a simple solution where a solid would be there and a solvent would be there. Along with that, some coloring agent and flavoring agent would be there. They are mixed together and then they are dispensed. So you can say that syrup is a solution. Okay, this nasal drop is a solution. This infusion is a solution. So this infusion is a solution. This is typical solution. This is syrup or solution. It's ingredient, then maybe water, and then we have many coloring and flavoring agent and preservative also. So solution, but different name is syrup. So a DOSH is aqueous solution meant for introduction into one of the body cavity, either for medicinal treatment or for hygienic purpose. Irrigation is a DOSH. Okay. To irrigate eyes, ear, nasal cavities. Suspension. Now suspension, when you have a solute which can be easily dissolved in water, then there is no problem. We will just dissolve it and then dispense it. But if the solid is not soluble in water, then it has to be made to suspension form. Okay, so that the patients can take it. If it is not soluble, then as you mix solid in solvent, it will settle down. Okay, and every time the patient will not get the same amount of medicine. So suspension is made. Now suspension, what there when we have a solid, immiscible solid, then we'll take the solute, and then we put some extra agent which is called a suspending agent. That will help in suspending the particles of the immiscible solute in the water. Okay, so that it will not settle down. The example is like of Dizine syrup, Dizine suspension. If you see that if you keep it for 6 months or so, you can see the two layers, the solid layer and then solvent layer. So it will have, and that's why it's said that you always have to shake before using suspension. Okay. Example is milk of magnesia, and so here we have the first phase which is solid, the second phase which is liquid, and the third phase which is suspending agent. So it has dispersed phase, dispersion medium which is water, and then suspending agent. Similarly, suspending agent can be gum tragacanth, acacia, starch, mucilage, glycerin, or another substance. Next, we have emulsion. Now we have talked about the solute or solid in liquid, immiscible. Now, when you put water, now when we put oil in water, what you will see? It will float. Okay, it will never mix. So, how to give the oily drug? You need to give the oily drug when, just a sec. Hello. नहीं यार 12:10 में खत्म होगा उसके बाद टीम से निपट जाना कुछ काम है so emulsion if we have oily drug you have to mix into the water and then it can be given so it will not be simply mixed up and oil is difficult to take as it is so emulsifying agent is being put an emulsifying agent will break the oil globules into smaller, finer globules, and that will be present thoroughly in the liquid. Okay, so that is an emulsion. Emulsifying like gum acacia, soap, egg yolk. The synthetic we have cationic, cetrimide, anionic potassium stearate. There can be dispersed phase, as I told, internal phase, continuous phase, external phase, and intermediate or interphase, which is emulsifying agent or suspending agent. Then we have the different type: oil in water, water in oil, or some other type. There are many other types also actually. O by W, O by W by O, O by W by W, W by O by W, and so on. So here we have O by W, that means oil is lesser in amount and water is more in amount. Oil is dispersed phase, whereas water is dispersion medium. Oil is dispersed phase, whereas water is in continuous phase. So these are the oil droplets, lesser in amount and water is more in amount. That's why it is written as O by W. Okay. And the example here is cod liver oil and castor oil. And benzyl benzoate emulsion. In addition to this oil and water, there is emulsifying agent which is being put to form an emulsion. Next is water in oil. That means oil is more, water is less. So water, these are the water droplets, and that's why it is written as W by O. Okay. So here oil becomes dispersed phase. Oil becomes dispersion medium, and water becomes dispersed phase. Test of identification, see, this one is like emulsion. Okay, it's a lotion but in emulsion form. So emulsion are usually white in color. When you make emulsion, you will put water and oil and emulsifying agent. Then you will see that there would be shift of color from the actual raw material color to gray and then finally to white if you prepare emulsion properly, because preparation of emulsion is very difficult, very difficult. Then comes lotion and liniment. See, which I showed is a lotion, it's white in color inside, and there is a liniment also. Girls must be knowing lotion very well, the body lotion and all. So lotion, what is lotion? How do you put lotion? Lotion is put without a rubbing, whereas liniment should be applied with a rubbing. These are the liquid preparation containing one or more than one ingredients which are applied on the skin without a rubbing, that is lotion. With rubbing is liniment. Okay, they have aqueous or watery base. Here liniment is oily base. Applied without rubbing, applied with rubbing. This is major difference. Used as soothing agent and antiseptic, act as antiseptic and counter irritant. Do not contain camphor, may contain camphor. Now syrup. Syrup are the sweet, viscous, concentrated aqueous solution of sucrose or other sugar in water or any other suitable aqueous vehicle. They are concentrated solution at 66.7% weight by weight of sucrose in water. So when you add sugar in water at this concentration 66.7, then it becomes a syrup. So this percentage will help the making the dosage form stable and inhibit the bacterial growth. Elixirs, they are not much in use now. Linctus, Livid, paint and sprays, the throat sprays and all, we have it. These are solution actually only, but this can be used as spray also. When you open it and when you use it, when you press it, it will come as a spray, right? So that is spray. Tincture leaf, gargle, everyone knows that it is used for infection of the throat and all, gargling. Mouth washes, you just need to wash your mouth, buccal cavity. Those are the mouth liquid preparation. Then enema can be evacuant enema or retention enema. Evacuant enema, we have soap water enema and used before surgical procedure to clear out everything from the large intestine. Water stimulates the rectum by distension, while soap acts as lubricant. Retention enema, the drug incorporated inside acts locally. Chiliform enema and paraldehyde enema are the examples. Then gaseous dosage form like aerosol, the gas or the volatile liquid. So we have the aerosol. Aerosol, the classical example are where we use the deodorant and now, right? But there are many other. In that carbon dioxide, fluorinated hydrocarbon, nitrogen, and many other gases are put in high pressure. Okay, so that when you press the button, the medicament comes in high force, and it will look like it's like a gas form, but actually it's a liquid. Okay, spray or dusting powders are there, metered dose aerosols are there in which the specific amount of drug will come. Advantage of aerosol, the regulation of the dose by the use of metered valve. So when you use like inhaler or any this one aerosol, that means one button would be there and there would be a valve. Okay, so when you use deodorant also you must have seen that when you press, a specific amount of drug will come out. So that is one advantage. Minimum irritation will produce because it will spread out. Antiseptic material can be sprayed onto the abraded skin easily, abraded skin, so that it will not pain. And the administration of the drug in the formulation via respiratory tract increases the efficiency of the drug. Rotahaler, I have just discussed. This is a metered dose inhaler. So we have the cap here. This is inhaler for asthma, and then cap here. This is and this is the mouthpiece, and there it has to be pressed. Okay. So if you see, this is the drug here. Okay, drug here. This is the drug here. This is just put inside this. Okay. So when you press, this will be pressed out, and then the drugs comes from this one. A simple thing is there. So when you press, that means only this much of drug will come, a specific pad. That's why it is known as meter dose inhaler. Meter dose inhaler. Okay. So that is specific amount came. So this is known as meter dose inhaler. This inhaler is also there, and then inhaler with a spacer device. That means spacer device is used for the person who cannot take. There are a specific guideline, a specific way of taking inhaler, using inhaler. there would be if you don't know the specific way, then there would be loss of drug. Okay, and then decrease in efficiency. So there is a spacer device comes, which is attached with this, and then patient is asked to take it. It makes it easier for taking, and then there would be no loss of drug efficacy, would be increased. So there are two parts actually. These are the two parts. They can be interconnected like this, and then you have a mouthpiece here. Okay, mouthpiece here, and this has to be placed. This inhaler has to be placed here. Okay, and then this has to be put in the mouth. You have to put it in the mouth, and there should not be any opening in between mouth and then the area of this. And then you have to just press this. The drug will come here, and then slowly, easily you can breathe and take it. Okay, there are flap inside so that when you inhale or exhale, it will open and close. Okay, this is very helpful for the people who cannot take drug easily or use easily. So this question. Now we have the gas cylinder. You must already be knowing about this. This is the oxygen cylinder and all. So the drugs can be in this form also. Volatile liquids, are general anesthetic and all, are put into the liquid form. They are dispensed in liquid form. They are transported in liquid form, but when used, the patient has to be inhaled. Okay, then we have packaging and all. We have different type of packaging like bottle, we have vials, we have ampules, we have strip packing, we have blister packing, we have tube, we have cylinder, we have sprays and all. So packing is not the topic for discussion here. What I could not show, I'll just show it. This is like ampule. This is known as ampule. Okay. Ampule is a vial. Here I don't have. Okay, yeah, I have the vial. So what is vial and what is ampule? This is vial and this is ampule. We have a vial and this is ampule. Okay, vial and ampule. Vial, we have a cap. We have to break it open, and then we can put the syringe inside. And this is the powder is there inside it. Powder is there inside this one. So this is powder medicament for injection. Then we have this is IV infusion set. You must be knowing with this roller camp, and these are the thing which is spike and all, which has to be put in the IV infusion bottle. This is IV infusion bottle. Then this we have, what is this? Yeah, this is the drop. Nose drop with a dropper, So nose drop with a dropper. Then we have the injection. We must have seen injection and needle. There are the many parts of injection, many parts of the needle also. That is not needed right now at this moment. We have the needle, and we have this spinal needle, so spinal anesthesia and all. Apart from this, what we have is this insulin pen. Insulin pen is there. Insulin pen is there. You have inside this already formed drug is there inside this. Okay, and one small needle comes which has to be attached here. And then whatever unit you need to take, you have to adjust from this turning thing. Okay, here numbers are marked. So whatever you want to take, you have to keep it to 8, 6, 10, 18, 20, and then put wherever you want, place the, locate your side, and then push this button. As you push it, the drug will be delivered. So this is insulin pen. Now the thing is, what type of question would be kept? See, if I keep this one, I usually will not keep this one, the whole packaging. I'll keep this one. Okay, I'll put it as a spotter, and then question like identify the type of dosage form. There you have to see the gases or aerosol dosage form. Okay, what are the uses? Give me one use of this. So that can be asked. What are the advantages of this dosage form? Those type of question may be asked. If I put like this, lotion. Okay, lotion is there. So what type of dosage form is this? So you have to say this is a lotion. This is a liquid dosage form or the lotion preparation, lotion dose. And what is the give me one difference of lotion with liniment? So that can be another type of question. Apart from this, if emulsion is there, then define emulsion or the type of emulsion. Okay, the condition where it is used, the condition where it can be used. Then this type, that rotahaler, I'll keep it, and then you have to say this is a rotahaler, which is meant for inhalation. Then this is dosage form, liquid dosage form, liquid dosage form. This is the IV infusion bottle uses, and some examples I may ask. So, like tablet, I'll put this dosage form, solid dosage form, name is tablet, and what are the different preparation? You have to give the example. What are the different types of tablet? That may be asked. What are the different things which are added? That may be asked. Capsule, similarly, capsule. What are the capsules? Define capsule. Then what are the types? Okay, so these type of question will be kept along with this spot dosage form. Okay, so I guess that is enough for today's dosage form. If in case any doubt is there, you can always contact me. Thank you so much.